5. Interestingly enough, tonight's promo did not edit properly. So I am going to do the promo live. And then I'm going to bring on my guest. So welcome to Joe's Place, the Joe Giannotti podcast. Tonight's guest is a board-certified doctor in general surgery and critical care medicine. After practicing for 5 years, she realized she needed additional tools to help her patients. The answer was functional medicine. She combined that into surgery practice for patients with GI issues, and it had an immediate benefit for patients. By using interventions such as elimination diets and gut healing protocols, patients would often say they have felt the best they have ever had. During the COVID pandemic, she has been using functional medicine concepts into the ICU, as well as with one very important example being the link between vitamin D levels and the outcome associated with the illness. We will discuss all of this, along with early and aggressive treatment for COVID, with my guest tonight, Dr. Mollie James. And good evening, everyone, and welcome to episode 15 of Joe's Place, the Joe Giannotti podcast. I am your host, Joe Giannotti, and sometimes what happens is immediately you have to do something on the fly because of technical problems, and that's exactly what I did. And let's get right into tonight's guest. She is the founder of the James Clinic, which is based in St. Louis, Missouri. Let us put up, you can go on right on to jamesclinic.com to find out more details about it. She has clinics in Sheraton, Iowa, as well as a new clinic that is opening in a few weeks in Wildwood, Missouri. She is an activist for medical freedom and patients' right to choose. Tonight, my guest, and it is an honor to have on Dr. Mollie James. Dr. James, thank you so much for coming on.
Hi, Joe. Thanks for having me.
And so I want to start off. We're now 2 years into the pandemic. What I want to do for those who are not familiar with who you are, I would like to begin 2 years ago. What did you see, and how did you get involved with early and aggressive treatment for COVID?
Yeah, so about 2 years ago, I was learning to ski on the ski slopes in Colorado when I heard them say they were shutting down the slopes. So I headed home. I was watching the news. I actually had my own case of COVID about that time. I was one of the first people in the area. And I listened to then Governor Cuomo's daily updates and press briefings. And he put out an all call for help in the ICUs and said that they were flooded. I'd always wanted to do kind of relief work, and very rarely do they need a critical care doc. So this was my opportunity to go. I wanted to go for two reasons. One, I wanted to learn what was working and bring it back to the Midwest. I didn't want it to have to go through the journals because there's always a delay in publication. So that was one reason. The other is very rarely do critical care doctors ask for help. And so I knew if they were putting out this all call that it was pretty bad.
Wow. And so, again, you had the original strain of COVID.
Yes. Yep.
I'm curious, what were your symptoms? And with the follow-up. Mm-hmm. And have you gotten checked for antibodies? And are you still getting checked for antibodies if you are?
So, yes, I had the original strain of COVID. And I think what happened, I was actually sick the first half of March. I was going back and forth between Colorado, traveling, kind of the normal influenza stuff. And I think when I got sick with what I thought was COVID was actually cytokine storm, because I remember the day and time I had the fever and I started coughing for 10 days straight and didn't stop. So yes, I had the alpha variant. It was pretty typical when I looked back, now understanding the disease process. I did get checked for antibodies because I wanted to be a donor of convalescent plasma. Um, I do not get checked for those anymore because I think there's a misperception that antibodies equates with natural immunity, and that direct connection just isn't there. So I try to practice what I preach, and I don't check a lab value that's not going to change anything.
Gotcha. A question right off the bat, and it's a great question because I'm going to ask you about this. So you use functional medicine.
Mhm.
What is functional medicine, and how have you been using it throughout the pandemic?
So basically, functional medicine is root cause medicine, right? A perfect example of this is people who have reflux. A lot of people take the proton pump inhibitors, the purple pill, Protonix, things like that. So what's happening is your body is giving you an alarm signal that there's a problem. And what we're doing is we're shutting off the fire alarm and we're not putting out the fire. So damage continues to happen in the body, but we've taken the symptom away, so now we don't know it. So basically, root cause medicine says, well, if you have reflux, let's figure out why. Let's change your diet. Let's change the supplements you're taking, reduce your stress, and fix your gut from that perspective. So it's root cause medicine. So how does that apply to COVID? Because if you understand the disease process of COVID, it's really easy to treat.
Yes.
Or much easier to treat than if you don't understand the disease process, which is unfortunately the majority of people who are out there right now.
Exactly. And what's crazy is 2 years in. It's not like we are still new here.
Correct. Yeah. So like drugs like Pepcid, right? People in the hospital, they won't even prescribe. Yeah, they won't even prescribe. Excuse me 1 second.
No, it's quite okay. It's quite okay. I was watching before.
Child care issues. They've been fine all day, and now they're acting up. So let me start where I was again. I'm so sorry.
It's quite okay.
Pepcid, right? So you can use Pepcid or you can use Protonix in the ICU for stress ulcer prophylaxis when somebody's on a ventilator, something like that. And generally we use Pepcid because it's cheap and it has the same efficacy. They're choosing Protonix now. And it's like, okay, so not only are you doing not what you do all the time, but you're doing something that's not a double benefit to the patient because you don't understand that it's a mast cell stabilizer, it's an antihistamine, and it's going to help with the allergic reaction and the pneumonitis of COVID ARDS.
There was a study, and this is why I want to bring this up. Mm-hmm. Study the effect of famotidine, which is Pepcid, correct? Mm-hmm. Make sure I have that right.
Yep.
Famotidine, thank you. On hospitalized patients, COVID-19, systematic review and meta-analysis. Mm-hmm. And so I know Dr. Robert Malone in his podcast with Joe Rogan mm-hmm. talked about how they were doing starting to do control trials on Pepcid or famotidine mm-hmm. and its effect on COVID. Yep. Again, I have acid reflux. I've had it for years, and I take Pepcid twice a day. Mm-hmm. So I don't know if that helped during the process. Maybe it did, but like I said last night on the air before I had my guest on, what I said was that I credited everything. I took ivermectin and hydroxychloroquine and doxycycline and the monoclonals, and I also took an IV fluid drip because for me, the worst of it was actually dehydration, even though I was drinking a gallon of water a day mm-hmm. and I was dehydrated. So everything worked out very, very well. And for me, it was very, very mild. Plus, one thing that helped, and one thing that helps, especially with weight loss, is when you go to one of these weight management centers, one of the major things they talk about is vitamin D. Mm-hmm. And my vitamin D, at one point in my life, and I've shared this story too many times, but at one point in my life, I weighed almost 500 pounds. Mm-hmm. And my vitamin D count was at 8. I have gotten that up to now 65.
Mm-hmm. Excellent.
So that I think, and I know between you have talked about, and you have put this up on your Twitter feed quite a bit, is about vitamin D and COVID outcomes. Please
Correct.
explain. Please explain
Mhm.
about
Yeah.
vitamin D and the outcomes.
So people think vitamin D is a supplement or a vitamin, so it can't be as powerful as a pharmacologic. Your body doesn't know the difference between what comes in a prescription bottle and what comes in a non-prescription bottle. It just knows how it's being used. So if you look at so vitamin D is actually a hormone that drives the immune system. And so if you have a deficiency in vitamin D, you have a deficiency in a number of the responses that tie to vitamin D. When I was in the ICU, I couldn't get anyone to check a vitamin D level, and I was seeing misdosing of vitamin D across patients, across different hospitals. I was working in about 10 different hospitals. So it wasn't just one or two people, it was across. So I generally prescribe 50,000 units of vitamin D3 a day for 3 days when somebody is initially sick. And I was doing this before COVID. When you look at ICU patients, they were dosing 400 IUs a day. That's not even enough to
No.
waste your time with. So eventually, I think after we rotated in and out. So eventually, I was starting to see the dose at least come up to 5,000. But there are a lot of things that can affect vitamin D absorption as well. So by the time you're critically ill, that's not the time to replace it. So if the federal government was serious about reducing COVID and improving outcomes, vitamin D tests would be widely available, more so than COVID tests, and we would have free vitamin D supplementation.
And personally, I get it checked twice a year, and that's what everyone should do. At the very least, get it checked on an annual physical. I have told every single one of my family and friends now, to the point of nauseum, that when you get an annual physical, get your vitamin D checked. And another question from Terry is, how much vitamin D should we take?
Yep, that's a great question. And one of the misperceptions is I have patients tell me, well, I take 5,000 a day or I take 10,000 a day. It doesn't matter what you take, it matters what your level is. So it varies, right? So you want your vitamin D level. I want it in my patients to be between 50 and 80. Up to 100 isn't a problem. Okay. So generally, I recommend at least 5,000 a day throughout the summer and up to 10,000 a day throughout the winter.
Wow,
So
that's a
probably
lot.
a lot bigger doses than people realize.
Wow, that is a lot. Much more than I have heard in general. Now, again, it also depends, because you don't. I have heard that if you're too high in vitamin D, that could be a minor health risk. Is that accurate? If, say, your vitamin D is above 90.
Correct. I've had two patients in my career over 100, and neither one of them were taking vitamin D. I think both of them had a primary bone tumor.
Wow.
So yeah, yeah. It's pretty hard to become toxic from vitamin D. It's a fat soluble vitamin, so it's not one that your body will pee out if you get too much of it. But again, out of hundreds or thousands of tests that I've done, I've maybe had two that were what I would consider high or alarming, and I've had most people are outside of the range of acceptable on the low end.
Wow. Wow. So I want to go back to COVID, back to, again, the beginning. So you recover from COVID,
Mhm.
and I know you have detailed about working in the ICU units. And please tell me if I'm wrong on this. You were in New York City at one point. Is that correct?
Correct. So early April, I volunteered. That was the start of my time in New York. I went for 10 days in April as a volunteer in Queens. And then I went back the next 2 months at a different hospital in Brooklyn as a locums physician. And I really liked the people that I worked with on the first hospital, and they were short and intensivist. So I took a job there. And so between April of 2020 and last September, I traveled back and forth between the St. Louis Metro and New York City working in the ICU.
Wow. That's a lot of traveling, because you
Mhm.
have your own clinic
I
that,
didn't then. I didn't then, in fairness. Yeah.
okay.
Yep. So I worked in a physical ICU in St. Louis. I worked in a virtual ICU situation in the St. Louis area. And then I worked in the hospital in New York. So it was basically two full-time equivalents still. Yeah.
Wow. And so Do you still work in the ICU in the St. Louis area?
No, I do not.
And I know you don't in the New York area. And please explain why you do not in the New York area.
So I just want to rewind to, I went there because the governor issued a plea for help. I then got it. So when that happened, they basically said, if you have a state license anywhere, you can come here, right? And we'll just blanket you a temporary license and you can come.
Right.
But I got a formal license, and so I took the job. And then when the new governor came through, she basically said there was a mandate in place that to maintain hospital privileges, you had to show a vaccine passport. I did not do that, and so I no longer have privileges at that hospital. And just for people listening, because they might think this was confrontational, I actually really like and respect the people I work with. And outside of a brief discussion and a brisk discussion about this, in which I said, well, your schedule's messed up, but you didn't really stick up for me. That was really the only discussion we had about it. And, I miss the people that I worked with. They were good people.
And it's very sad. It's very sad. But I will share something with you. There is a larger group than you think that live in, and again, I live in roughly the same geographic area that you worked in.
Mm-hmm.
There's a larger group than you think that are fed up with mandates.
Mm-hmm.
Actually, there's a larger group that want to ask questions on why vaccination is not working.
Mm-hmm.
Because people were told, you take your 2 shots and you can go back to normal.
Mm-hmm.
That didn't happen.
Correct. So just to like the irony here, in September they did a healthcare heroes parade to honor the people that had taken care of patients throughout the pandemic. A block from there, a week later, I couldn't get a sandwich in a restaurant. I went to get to go, and I was turned away at the door because I didn't have vaccine papers. So it was very surreal.
It's disgusting.
Mm-hmm.
It's disgusting. And let me ask you then. Now you're in Missouri.
Mm-hmm.
Is it like night and day compared to New York?
Yeah, I kind of lived in 3 different worlds. So I was going between New York City, Iowa. We stay at the lake in Iowa, and there nothing was happening. Like they were going about their normal lives. Nobody was sick. Nothing was happening. We enjoyed our summer at the lake, no problems. And then St. Louis was somewhere in the middle, right? Some people were wearing some masks. Some people were back to normal. It was kind of split. So I was going between these 3 different worlds that had very different experiences of the pandemic. And it was just so interesting.
It's bizarre. Even last night when I spoke to Mindy Lefevre's, she had mentioned that even in Florida, with masks, there's still about, and she's in a very conservative area, still about 30 to 35% of people are wearing them. And again, I'm very anti-mandate. It should be up to the person to decide if they want to wear one or not. Sadly, for those that are very pro-mask, recent data has shown that cloth masks just don't work. And the only masks that work, you have to pay an arm and a leg for, and you have to they have the P100s are the ones that work, relatively speaking, but they only protect you. They don't protect the person that doesn't have one on.
And they're extremely awkward and uncomfortable.
Have you ever worn one?
I didn't have access to one. During the heat of the pandemic, there were people who made rounds in those. I had an N95. I had natural immunity. I wasn't too, after the first week or 2, I really wasn't too concerned.
Gotcha. Yeah. And, I want to talk about, since you talk about your, talk about gut health.
Mm-hmm.
Gut health seems to be so important in so many levels. And I just want to talk about just gut health versus just how that affects overall health, just in general.
Yeah, so your gut basically drives your immune system, and it basically drives your neurotransmitters. So if you think about it, your gut is what filters out the outside versus the inside. If you think of a person as a donut with a hole in it, the GI tract is the donut hole, right? That's how your body engages with the outside world. So what happens is there should be a very tight seal of the tube, your lining of your gut. And what happens is when you eat things that are offensive, so such as gluten or too much processed food or sugar or chemicals, things like that, what happens is those tight junctions that protect you on the inside from the stuff in the lumen, the gut, is that starts to open up. We call that leaky gut. So when you have leaky gut, what happens is I always joke about like orange Cheeto powder, right? Your body doesn't know what to do with orange Cheeto powder. It knows what to do with protein, fat, and carbs. So if orange Cheeto powder gets into your bloodstream, your body's making an immunologic response to that. And so that's what happens is that if your gut is compromised, your immune system is already fired up and distracted and probably not as responsive to when there's an actual infection.
Very interesting. Very, very interesting. And I know that gut health and liver are very, very correlated. They're correlated.
Mhm.
And so I hear a lot of stories, including myself, that everyone has fatty liver.
Mhm.
Explain that correlation. It's still confusing to me years later after I'm being told that, but I'm just curious what that correlation is.
So 75% of the blood flow in the gut goes to the liver, right? Because the whole point of the circulation in the blood flow is to bring the nutrients from the gut up to the liver to be processed into protein, to be detoxified, the metabolic pathways for detoxification. So if you're eating things that your diet doesn't align with what you should be eating. So for example, if you're doing a high fructose diet, high refined sugar, where your blood sugars are high, the liver is going to be overtaxed, and eventually that's going to put a stress on the liver, and it's going to be forced to store all of that excess sugar as fat in the liver. Is a very simplistic way to look at it. It's obviously more complex than that.
Right, right. But I mean, as I said, especially one thing that I do know, again, having lost as much weight as I have without surgery,
Hmm. Good for you.
thank you very much. They have to thin the liver out in order to do certain things. For example, to even if you have to have bariatric surgery, you have to thin the liver out before surgery. So, they give you different diets and and it seems like the diets are, just essentially plain food, just liquids and,
Mhm.
and things like that, just to get, but it's not just, I believe that it's not just for thinning out the liver. I actually think it's also just to prepare the person for
Mhm.
their lifestyle change or their overall diet in general.
Yeah. Well, when people get in that situation, they're actually fairly malnourished. They may be eating an excess of calories, but the nutritional component isn't there.
Which again brings to vitamins and supplements that most people don't take.
Correct.
And what would you recommend for a protocol of vitamins for someone to take?
Yep. So there's kind of three categories of vitamins. One is just your general, what should I take to be healthy and augment my diet, right? Because when you look at the food you eat, you have to be honest that it's not coming from as nutrient dense soil. It's not, the food is actually not as nutrient dense as it was 20, 30, 40 years ago. So there's just general things to replace, such as vitamin D, a multivitamin, omega 3s. Then you look at categories of supplements to replace what other prescriptions are taking away. So a good example of that is that patients who are on metformin should be on B12. That's it. That's just an obvious one. There are other medications that cause other vitamin deficiencies. One of the most common is melatonin. I think that's associated with like Prozac or fluoxetine. So that's the second category of meds, replacing what is deficient because you're on a prescription medication. And then the third category are prescriptive nutrients. So one of the ones I use often is called berberine, Berberine, berberine. It actually works a lot like metformin. It helps, it's an anti-inflammatory, it's great for the gut, and it helps control blood sugars. In randomized controlled trials, it's shown to be as effective as metformin without the GI side effects. So those are kind of the three categories of supplements that I check off. There are things such as DIM, diindolylmethane, that helps the body process estrogens. So it's good for men who are on testosterone therapy so that they don't get stuck at the estrogen metabolism it keeps going through. It's good for women who are overweight in that estrogen dominant figure. Um, so those are kind of the basic ones that I use. A good B complex is always helpful.
I've been taking a B complex for over 20 years.
Yeah.
So that's how I know about it, thanks to my great aunt, God bless her, 87 years old. And because and the only reason why I knew about between that and vitamin D is because of the Weight Management Center, because these are vitamins that are vital toward being in good health. And I'm glad that we're actually having the discussion about overall health, because that's one thing that is very dear to my heart,
Mhm.
having lost all the weight. And at the same time, having the vitamins and the supplements normalized or in the upper level of norm leads to better outcomes for upper respiratory infections and COVID in general.
Of course. Yes. You think about it like a link in the chain, right? Wherever there's a weak link, the chain is going to break. So you maybe have a great vitamin D level, but if you're deficient in like magnesium, you may have some problems. Or if you're deficient in CoQ10, you may have other issues. So it's not just one or the other. You want to comprehensively be at a high level. And keep in mind, too, that the recommended daily allowance, so what the federal government says that we need, or the levels that they say, those are average. Those are not for high performance, right? So if you're a person who's working a lot, extra stressed, long hours, if you have a stress on your body, you need far more than the recommended daily allowance.
Exactly. And with the ICU patients that you were seeing,
Mhm.
how deficient were they?
Well, I would love to tell you that, but no one ever checked it. So really, I would try to get a snapshot of vitamin levels. Yeah, I know it's terrible because I wanted to know for myself. Some of this I was learning, right? So I wanted to know what's the average vitamin D level of somebody in the ICU. Generally, it was less than 30. Um, and the other things I have access to check in the hospital are like a big B12 and a folate level. And to me, that was just a snapshot, right? Because if all three of them were in pretty good shape, I figured we weren't terrible. Um, but I can't do comprehensive vitamin panels in the ICU. The labs don't provide it.
Wow. That's a shame, because
Mhm.
they should have checked the vitamin D levels, especially now. I mean, there's a lot of ICU patients now with COVID. I mean, we have plenty of data that shows that being very deficient, especially with under 20 level, leads to bad outcomes.
It does, and for anybody who struggles with like seasonal affect disorder or depression, vitamin D level is one of the first and easiest things to check because if your vitamin D level is that low and you replace it, sometimes those symptoms get significantly better.
Wow, I did not know.
Hmm.
Very, very interesting. And again, you recommend 10,000 units a day.
Hmm.
Do you recommend that for someone just starting? Do you recommend, if someone's just starting, do you recommend essentially just go 10,000 a day, or do you do the 50,000 international units weekly?
So I've heard it both ways. Some people feel like the daily is more effective. It's absorbed better. It's a more consistent intake. I'm not very good at taking pills, so for me, the once weekly. Sometimes I do it twice weekly. That's a little bit better. So I'm not a big fan of like the same exact regimen every day. I kind of think people should rotate and roll them a little bit, just like we kind of rotate our diets. You don't have to have the exact same thing every single day
Right.
as far as vitamins go. And that helps some people that I take care of that are on a little bit of a budget. I'm like, take a half a dose or take it every other day, and stretch it out. If that fits your budget better, you're better to do that than go buy your vitamins at Walmart.
Exactly.
You're getting better quality.
The one thing that I did during COVID was I ended up having a super immune boost, which was which was an IV drip.
Yeah.
And talk about powerful. I mean, I had 10 grams of vitamin C.
Mhm.
I had vitamin D, I don't know how much. I had 400 milligrams of zinc, and it went right into the bloodstream. It bypassed the stomach. Again, I'm curious on what's the difference between going right into the bloodstream and going through the stomach. I'm just curious about that. I didn't understand why the nurse said that there was a difference.
So it's based on bioavailability. So, like, for example, vitamin D, you probably didn't get that in IV. You probably got that in an IM injection. That's usually not given IV.
Well, I had an IV. I had an IV of fluids, and they just put in the different vitamins.
The different features, sure. So like for vitamin C, for example, when you take 1,000 milligrams of vitamin C, by the time it goes through your gut and you absorb it and you process it, maybe you get 100 milligrams. So you lose a huge percentage of what you're taking that gets into the bloodstream.
Interesting.
When you get an IV, like you said, it goes straight in. You're not dependent on that first pass metabolism.
So, and again, nobody understands this. So even though you're taking a 1,000 milligram dose,
yeah,
you're only absorbing a tenth of that.
A percentage, yeah, quite a small percentage. So again, when I'm taking care of a COVID patient, I tell them to take 1,000 milligrams an hour if they can tolerate it. A lot of times they'll have GI upset and can't take that much.
Right.
Where we do 25 grams through an IV in 30 minutes.
It's much better off. Mm-hmm. And works.
Yeah. Probably what it does is the inflammation from COVID causes a lot of oxidative stress. And so the vitamin C comes through, and it's an antioxidant, right? So it can pick up all these free radical scavengers. It can scavenge those and get rid of them. So it reduces that secondary injury of inflammation on the body.
I want to talk about a topic that you and I very dear to us, mm-hmm. and that's the topic of medical freedom. Mm-hmm. I have my bracelet from, again, this is Matthew Crawford's Rounding the Earth Substack. Mm-hmm. Matthew is incredible. He's been a guest on my podcast 3 times, and we have discussed different COVID data, which actually I think is more important now than ever before. Matthew, and again, Matthew also looked at Dr. Tyson's data of the 9,000 patients that he has successfully treated with COVID. Now it's over 10,000. And the book that they have out that just came out 2 weeks ago, Dr. Brian Tyson and Dr. George Fareed. Mm-hmm. And so Matthew and I started a medical freedom wristband project. And I will come clean and say that I have sent you some wristbands.
I have them. I don't know where it is right now, but I have mine.
But they're great conversations.
Absolutely.
That's the one thing that I like, that they're great conversations. And you'd be surprised, even with someone you might disagree with, how there are things that you actually agree with. Mm-hmm. And more people are questioning the narrative. Because, like I said, they thought that the vaccines that was it. Once you took 2 shots, they were told, they were given a bill of goods saying, you're prevented from getting COVID. And it turns out that's not the case.
Right. So if every piece of information that they gave us on the mainstream media news was correct, right? Everything they told us was perfectly true. The vaccines are 95% effective and they're completely safe and they will end this tomorrow. And ivermectin is horse paste. If that all was true, people still have the right to choose against that. The reason medical freedom is so critical right now is because the narrative is so wrong. And we need the freedom because if medicine drifts off course, right? And I think COVID is the canary in the coal mine. COVID is what told us where the gaps are, right? I always knew that the hospitals weren't serving their patients the very best, but I thought we tried, and there's just some normal gaps that are always going to happen because not everybody practices holistic medicine or functional medicine and things like that. But if your doctor didn't learn how to treat COVID, the most significant medical issue of our lifetimes, what else do they not learn how to treat? Did they not learn how to treat blood pressure? Did they not learn how to treat diabetes properly? It's just, it tells you, like, are they critically thinking? Or are they just doing what someone told them to do? And even if you take an organization like the American Diabetes Association, right? Pretty much everybody thinks they're wonderful and they're advocates for diabetics and they want health and this and that. But if you look at the diet that they recommend, it actually would make diabetes worse over time. So they have a bias, right? Because if you cure diabetes and there's no one to join the American Diabetes Association, they're out of business. So everybody in medicine has a bias, and a lot of it is driven by money.
Sadly, the root of all evil, money.
Yeah, and money makes the world go round, but when you're compromising patients for money, that's when it can't be justified anymore. You're on those ethical boundaries.
And how many millions of people have been seriously injured and have died because of the medical malpractice of decades and decades?
Yeah.
I give this example all the time that as a meteorologist, that's what I do for a living. And what I see, you go on these weather channels and all you see are commercials by law firms. If you've been injured from this pill or that pill or this shot or any medical malpractice, call us. And it's just amazing the amount of class action lawsuits there are now. It's become a business.
Yeah, absolutely it has. And I've always kind of been on the other side of that, right? Being a physician is difficult because you have patients and humans are messy and medical situations are messy. And I always used to be just so offended when I would hear, someone on TV say, well, the doctor screwed up, so you had a bad outcome. Well, you can have a bad outcome even if the doctor did everything right. And so I've kind of always been on the other side of this. If you take care of your patients with moral and ethics and a high level of competence, it's really hard to hear those kind of things, right? Because you can't imagine that your ethics would be swayed by money or you would have anything other than the patient's best interest at heart. So for me, that's what's really hard. Because, and I want to be clear, I don't think that the doctors and nurses at the bedside, on the whole, want anything other than the best for the patient. I really don't. They just, we can go into why the injustices are happening in the hospital right now, but those were the people I worked with. They're good people. They're there to serve. It's just, we've gotten way off course with COVID. And I do have horror stories, so I know it's gotten way off course.
And Molly, one problem is that because the medical establishment, the corporate medical establishment, and the Faucis of the world have led to so much distrust. Now, one problem that's going to occur post-pandemic is that the lack of trust in the medical profession is going to be at an all-time low. And that's not good because you need to trust your doctors that they can provide you the service that you need, especially when you get sick. And interesting, when you mentioned what can't you trust your doctor if they can't treat COVID, what have they not been treating properly? For me, for 15 years, I've only had one instance where I got rid of a cold in any less time than COVID. So it tells me that the doctors that I thought were doing a good job were actually not doing a good job.
No. And I think if you look at the motives of that, again, this could be another whole week of episodes, but the dumbing down of medicine comes back to, if you make people who want to take orders, right, who follow protocols that are written by some authority that they don't know, if that's what you become in medicine and you lose the critical thinking and you lose the ability to speak up and advocate for your patients, you're going to get less quality medicine. And I think they've done that. They have, it's become big pharma indoctrination camps, and physicians are taught that they're hourly workers. This is now indoctrinated as a resident because you punch a time clock and you can't work more than 80 hours a week. So instead of treating you like a professional that you're about to become, you're equated to a burger flipper at McDonald's that you're on overtime and you need to leave. And I've never agreed with that. I came from the surgical background. My residency class was the first year they limited us to an 80-hour work week, which 80 hours is a heavy week. I'm going to give you that. But it took away the professionalism, because instead of taking care of patients and them being the focus, it was, how do I get through my 12-hour day? How do I get the patient to the end of my 12 hours and make it somebody else's problem?
Right. Exactly. And when you said that, the first thing I was thinking of is, I'm thinking of all the doctors I've interviewed so far. And again, it just hit me. Every single one of them has their own private practice. They are not in the corporate medical structure. Like, if you look at their resumes, you don't see, you'll see a college or two, meaning, where they had their residence and stuff like that, but they're not affiliated with a hospital of any kind.
Yeah.
And
to successfully be treating patients with COVID right now, you have to be independent, because corporate medicine has, and this is the conflict of interest that people don't understand. Like, this is the part that makes my blood boil, right? Is corporate medicine has made this edict that nobody under our umbrella can offer early treatment. Nobody under our umbrella can give an exemption for vaccines. Like, that's been stated, not subtly. This has been overtly stated to people who work within those systems. But then you have this giant conflict of interest, because if you have their entire patient base that is not offered early treatment, the chance of ending up in the hospital is much, much higher. And the financial incentives for that to happen are extreme.
It's horrible. Then what's the point? I'm curious. Then what's the point of having health insurance?
Yeah. I mean, honestly, for a lot of people right now, it's catastrophic, right? So if you go into the hospital with a ruptured aneurysm or emergency heart surgery, you need something to protect you, right? So you don't go bankrupt paying your medical bills. Outside of that, insurance really doesn't pay for anything that's helpful either. It hasn't for a long time. It doesn't pay for the IV vitamin drips. It doesn't pay for weight loss things unless it's a specific kind. It doesn't pay for vitamins and supplements. It doesn't pay for preventive medicine. It doesn't pay for natural hormone replacements. They pick and choose what they pay for, and oftentimes it's not in the patient's best interest.
Exactly. And it's sad. And I pay enough a year in medical coverage because I have chronic ITP, which is a chronic low platelet condition that I've had for over 25 years. And the treatments that I get cost an arm and a leg if I was to not have medical coverage.
Yeah.
And so I have to have the highest medical coverage, or else I'm paying an arm and a leg. But the problem is that this is also the same corporate medical structure that's not treating me.
Mm-hmm.
And I have to go to private means to get properly treated and pay.
Yeah. Most people do. And that kind of ties back to what Joe Rogan said. So he did that video this week, a couple days ago, maybe yesterday, addressing all of the hubbub that surrounded his recent controversial episodes. And what he said is that you need to discuss this with your doctor, right? At the end of the day, you need to discuss this with your doctor. And for 20 years, that's what we've had, right? I've had the responsibility that somebody's going to come discuss something with me, and we're going to talk through it and figure it out. And we're the ultimate decision makers of that. That is great unless there's coercion that I just talked about. If there's coercion where a doctor can't speak freely and give recommendations and have that fiduciary responsibility to do the very best thing for the patient, when you change that and you ethically squeeze that out so that's not possible, then you can't rely upon that.
No, you can't. But I'm going to go further. What happens if you can't trust your doctor? I mean, especially for an illness. I mean, you can't. For many people, can't suddenly just find a new doctor. Mm-hmm. Because oftentimes it's already too late.
Yeah, I don't have a good solution for that, because my phone's been ringing off the hook since I put a phone number up in September. And, as I talk to people to help them with their COVID situation and get them ready to go, they were telling me, I'm never going back to my doctor. My doctor told me I need to get the shot so they don't lose their job. My doctor told me I need to get the shot because they're about to expire and they'll have to throw them away. I mean, people are smart. They know that that's not a good medical justification for why I should take risk on something. So they've told me I'm never going back to my doctor again. I'm never going back to this hospital system. Like the trust is absolutely shattered, and corporate medicine has done this, and it is never going to go back the way it came.
What? No, it's not at all.
Mhm.
They've gone way too far over the deep end
Yeah.
at this point.
Yep.
And I'm going to share something. I was going to do this tomorrow night, but I'll do it tonight. Um, I walked out of my job of 17 years because, and again, it's federal government contractor. There were other reasons, but a major reason was that at some point I was going to be forced to get vaccinated. And I said no. I
And I
said,
think I think that's a wise choice. I'm really tired. This goes to autonomy, right? And goes to adult choices. I am so tired of the people that message me and say, I had to do this or I have to do that. You need to stop and you need to take responsibility for your own bad self, right? So if you want to take a shot to keep your job, that's your choice. But you don't have to. Nobody makes you do anything. At the end of the day, you make those decisions and you're responsible only for yourself. And so I'm tired of people giving that kind of power in their life and authority to other people.
right, exactly. But and for me, in my case, it's a federal government contractor
Hmm.
because it's involved with the federal government and Biden himself.
Hmm.
So the reason why I did not, I was planning to get vaccinated.
Hmm.
I had all indications I was going to get vaccinated. I went into the Johnson & Johnson trial. That's how much I wanted to get vaccinated right off the bat in December, January of 2020/2021.
Hmm.
Then I heard the story of Dr. Gregory Michael, who was an OBGYN in Miami, Florida. Took his first Pfizer shot, contracted severe ITP or severe thrombocytopenia, dropped dead 3 weeks later. So I always have to see, there's a major difference between those who have chronic conditions and those who are just healthy. Those who have chronic conditions have to naturally be careful about what they put inside their body, no matter what. And I'm one of those people. Having a condition for 25 years, I have to naturally be careful. I have to look at, even on a drug that I might be taking, I just don't assume what the doctor tells me is truth. I have to read what is in the medicine.
Hmm.
And I have questions. Like, for example, one of the medications they were trying to give me has an issue with liver damage. And I said, is there a problem? And I get 3 different answers.
Hmm.
So because of that, I decide I'm not going to take it. But this is the reason. So since the Dr. Gregory Michael situation, let me bring this up. I want to bring this up to the stream. So I did a medical Substack, one of my earliest medical, and by Molly, my Substack is called Medical Freedom.
Love it.
Okay, thank you. And this is ITP and TTP and the COVID vaccines.
Hmm.
If there was 1 or 2 papers, then you know what? A doctor might have justification to say, it looks like it's pretty good. There's only 1 paper that only has a few patients. And the research is showing that's pretty good for patients with a certain illness or a certain condition. No, there's actually 31 research papers in a span of 7 months. 31, all negative, about ITP and TTP and the COVID vaccines. So when I'm looking at this and I'm putting 2 and 2 together, it tells me I should not be getting these shots. I mean, it can't be just me. Other patients, and of course patients that you see, would come to the same conclusion of, you look at research and you look at data and just shows that there could be major issues with medications.
Absolutely.
And
Yeah. So this is what bothers me though, is, in the ICU, I didn't just take care of COVID patients. I took care of people who had cardiac devastating illnesses and issues after the vaccination. I had a patient who 24 hours after Moderna had a cardiac arrest. I had 4 patients in an ICU of 15 on ECMO. One of them had a 7-vessel MI and a PE, blood clot in the lungs, 3 days after Moderna number 2. I had a patient whose mitral valve, for no uncertain reason, blew one day and went into acute heart failure and had 2 open heart surgery procedures. I had a patient who was a Pfizer fail at 6 months to the day, ended up in the ICU on the ventilator and on ECMO with COVID ARDS. And I can't remember the details of the 4th one right now. That was at one time in one cardiac ICU.
Wow.
And I know I'm not special. So any other intensivist who's working in a cardiac ICU is seeing the same thing. So why aren't they speaking out? Why aren't they raising concerns? Why aren't they connecting the dots? Why am I not hearing from them? That is what bothers me. What bothers me is the number of doctors who are okay with censorship, the number of doctors who are busy and who are seeing this in their practice every day. They know that they are, and they're not speaking up, because I've talked to all kinds of nurses and doctors who work in these different clinics, cardiology, rheumatology, hematology, and neurology. I ask them, are you seeing any problems? And they're like, we are absolutely slammed. Of course there's a problem. Why aren't they speaking out?
And from what I've heard from other doctors is the same thing.
Mm-hmm.
And to the point where it's getting ridiculous now. It's actually getting ridiculous. To the point where, why is there not more doctors, than, and let's bring it up. This is a great transition to the 17,000 doctors. Give me 1 second. I'm going to bring this up. To the 17,000 doctors who have signed the COVID Summit Declaration, the Global COVID Summit Declaration.
Yeah, so this is a group of 17,000 physicians and scientists. So these have all been vetted. They are confirmed physicians and scientists. Basically, what we have said is we disagree with the narrative that has been propagated by our federal government and by the WHO. Looking at direct data, we have a different thought about that. And there are 3 main points to that. Number 1 is that children should not be vaccinated against COVID. COVID poses essentially no risk to them, and the risk of the vaccines is monumental. Number 2 is we feel natural immunity should be recognized. This is the only illness ever that anyone has even dared to say that you need a vaccine when you have natural immunity. It's just absurd. And the third is that let doctors be doctors. I don't tell any other physician how to treat a patient. I never have. I've always signed them out and said, hey, here's what I think is going on. And I hand over the baton for them to do the right thing. I don't want anyone to tell me how to be a doctor.
Exactly.
I'm happy to listen to education, but at the end of the day, it is my license and it is my professional reputation on the line, and it is my credibility. And at this point, the fact that medical boards are targeting physicians who are treating patients as we see fit, it's really absurd.
I think, and I've blew up the 3rd declaration on intentionally, because this is in my opinion, they're all very important, but this to me is the most important one. That all health agencies and institutions shall cease interfering with patients treating individual patients. We need to go back to doctors treating patients on an individual level and not in a one-size-fits-all method.
And I've given this a lot of thought, right? Because I've been in medicine now for 20 years. I don't know what's worse. Is it worse the doctors who don't know? Or is it worse that the doctors that know and tell patients, well, there's some medicines that can help you, but I can't prescribe them or I'll lose my job? Is it worse to be uninformed and incompetent, or to be ethically compromised? I haven't come up with an answer. What do you think?
It's a great question. It's a great question. I almost think that what's worse are the people that are referring to this right here, and I'm going to show it for the second night. refers to this as horse paste.
Yeah.
That to me is a crime. This was prescribed to me by a doctor. It even says it's for RX only. So that's prescription only.
Mhm.
I think it's disgusting. And I've had vaccine injured patients on my podcast, Molly. And it is just so sad to hear that they can't even get anything like ivermectin. They're just told, rest. They're just told, we can't do anything for you. People don't want to hear that.
Right.
People don't want to hear as they're suffering and in some cases dying, that they don't want to hear that there's nothing you can do. It's infuriating.
The targeting of ivermectin, I think people need to go back and look at what other repurposed generic drug has ever been targeted like this ever in the history of.
Well, hydroxychloroquine.
So
But hold on, let's be fair.
ivermectin.
But I want to be fair to you.
Yeah.
How about a time in history?
Yeah.
Time in human history. There has never been a time in human history like this where early and aggressive treatment for COVID has been attacked. And the way it has been attacked is actually disgusting. That has led, sadly, to the deaths of too many people. Way too many people.
Yep. And when you look at big pharma, right, they've actually depended upon off-label prescribing for years. What they do is they select a specific diagnosis. They develop a study to show efficacy in that specific diagnosis, right? They get their drug passed through the FDA. So now it's an FDA approved medication. I, as a physician, now, once it passes through the FDA and it's approved, I can use it for whatever I want. Logically, of course. So they've depended on this for years for profit. This is the only time, only when it threatens their profit and their bottom line is it a problem. And so the medical boards should really be careful when they're targeting physicians, because off-label prescribing is off-label prescribing. And I was actually in a hearing, in a court hearing on behalf of a patient this week. And unfortunately, I was listening to the testimony of the physician with the hospital, and he stated that he never prescribes anything off-label. I would challenge that. I would challenge any physician out there to look at the top 10 drugs that you prescribe and what are the FDA approved indications for those. And I would ask the same of a pharmacist, because I can tell you, I don't know what the approved indications are. I know what the drug does. I know when to use it and I know when not to use it. And that's all I need to know. It's irrelevant. So the targeting is specific to these two medications and the motives are clear.
The moment you mentioned about FDA and drugs, I remembered that I found this before the pandemic, and now I'm going to post this. So this is a list. This is a list of the 50 most dangerous drugs that are FDA approved. Okay? This is and let me go to the beginning. Let me go to I'm sorry, I'm going to go to the top 10 in particular.
Okay.
Okay? Here are the top 10. Cyclophosphamide. And again, I'm sorry if I'm saying these names wrong. I'll use the brand names, okay? There's a drug called prednisolone or
Prednisolone.
Thank you. Let me go right to number 4. You see rituximab?
Mm-hmm.
I've taken that on 2 separate occasions because apparently it can be used as a treatment for chronic ITP. Mm-hmm. Now, this was before I was over almost 500 pounds at the time. And I wasn't thinking, being in my early 30s, I wasn't thinking about doing all this, checking. And turns out it's one of the most dangerous drugs. But it's amazing how all these drugs, again, dexamethasone, which surprised me because isn't dexamethasone being used by the being used as a treatment for COVID in the hospital setting?
So it is almost exclusively the only steroid being used, and it's being used at minuscule doses. So you have a patient with an inflammatory blood clotting problem, and they chose a tiny, tiny dose of steroid to treat that. No wonder people are getting worse.
It's ranked number 6 on most dangerous drugs by the FDA. Why would if it's in the top 10, why are you prescribing it?
So when we have patients with airway compromise, we use dexamethasone 10 milligrams every 6 hours. So if you have someone dying of a lung problem, is that not as significant as someone who has an airway compromise problem?
No, I'm just asking because
No,
just
I agree with you. Yeah.
and again, I'll just round out the top 10. However, I am going to go to one more. During that whole period, Molly, the most dangerous drug that I took during the entire period of when I had COVID was that one. So not on the list is this.
Mhm,
That is not on the list.
mhm,
Hydroxychloroquine's not on the list.
mhm.
Doxycycline's not on the list. But Tylenol is on the list.
Yeah, people don't realize that Tylenol causes a glutathione deficiency. And glutathione deficiency, other than vitamin D, is one of the nutrients that you that's correlated with a poor outcome when you're deficient. So
And
that's why you're taking the NAC, the N-acetylcysteine. Some people do glutathione injections.
I took a number of doses. I took about a week's worth of NAC, and then once I got better, I stopped taking it.
Mhm.
But what? And I'm kind of confused about NAC. I mean, I'd never taken it before. I only took it during the COVID period.
Mhm.
What's the benefit of it? I don't understand that.
So NAC is a precursor to glutathione. So it helps your body make glutathione. Glutathione is the most potent antioxidant that circulates. So um, correlated with most health outcomes.
Gotcha.
Mhm.
Yeah. Again, I maybe I should just start taking it whenever I get sick from now on.
And it's great for the liver too. When you're talking about liver detox, that and N-acetylcysteine is one of the main supplements that I would put somebody on if we were focusing on like a liver repair um, or support. They use it in the hospitals IV for Tylenol overdoses specifically.
Really
Hmm. Yeah.
interesting. Interesting. I think maybe the other reason why I was put on is because I can't take aspirin because of my condition, so I was put on Tylenol.
Hmm.
Which again, I was fortunate. I only took 2 Tylenol each day, but I guess taking the NAC balanced things out, having enough glutathione in my system.
Yeah, hopefully. And that's why some holistic people tell you not to take Tylenol when you have a fever. You don't want to dampen the body's response, and you don't want to deplete glutathione. But I kind of think as a grown up, it stinks to have a fever, so you just have to do what you have to do.
And I, fortunately for me, each day I only took 2. That was it. 1 dose. That was it. Done.
Yeah.
And I also remember part of the fluid drip. It also came with glutathione,
Hmm.
and that was really, really good.
Hmm.
I highly recommend these fluid drips. I know you got to spend a few bucks. And again, I'm not talking about the NAC that Joe Rogan took. I'm talking about like a super immune boost that cost a lot less money.
That's pretty much what he did.
Yeah.
Yeah. Yeah. So, yep,
And
we're doing that in my clinic. That's one of the things that we're bringing and
so,
introducing.
so please explain the James Clinic. Please explain what you do. And I'm going to show afterwards, I'm going to show photos of things going on in the new location in Wildwood, Missouri.
Yeah. So this really kicked off. I have had a functional medicine clinic before. Um, I needed a break for a while. I was taking that break and probably getting ready to relaunch when the pandemic hit. So as the two forces aligned where I could no longer ethically tolerate being in the hospital and having life-saving medications not available to my patients, and also being pinched and treated like a second class citizen because I was riding my natural immunity and didn't want a vaccine I didn't need, I left the hospital system. And about a month before that, I had opened my clinic. It was under the URL ivermectincan.com. That was just my cheeky approach to get into things. I started seeing patients. Southwest Missouri had a huge surge at that time, and I have a couple of friends who are physicians down there, and they kept posting on social media, you know, these dramatic, life is terrible and patients are awful and these dramatic stories. And I kept asking them, like, well, are you treating anybody? Are you offering anybody any treatment, or are you just coming to Facebook to complain about it? So I opened my clinic in hopes to get people early treatment. That took off pretty well. I do prevention consults and acute consults. I was 100% virtual. And what happened is my brother got sick in October. This is a story we've told a lot. So he's 300 plus pounds. He's a big guy.
Sorry to interrupt. October of 20 or October of 21?
21.
Okay.
Last fall. Yep. And he got sick. We started early treatment, and he dropped his sats to 80%. And I kind of knew how that story ends because I was doing everything I could as an outpatient. So what happened is we went and did hyperbaric oxygen, and we got in a chamber. We got him stabilized. He was off of oxygen 4 days later and back to work in a week.
Wow.
Yeah. So we compared that to a person, similar health, similar size, got sick at the same time. 6 weeks later, was in a hospital, trached and on a ventilator still. So when you look at plan A versus plan B side by side, it's a no-brainer. So what happened is my family, as they would hear about people getting sick, they would call me and want me to help. And there's only so much you can do virtually. So I dropped a clinic in my hometown of Sheraton, Iowa. It's a tiny office, but we have 2 hyperbaric chambers. We have IV medications available there. We can send patients in to get stabilized and then manage them virtually for the majority of their care. So my best case so far, I had a patient, again, overweight, bad diabetic, lots of insulin, extremely high risk, called me day 12. Her stats were 69%. So my family took oxygen to her. We got her in the chamber the next day. She never set foot in a hospital. She's still at home, and she's almost off of oxygen.
This is just recently.
Yeah. This is, since the new year.
Why is it? Because you just mentioned day 12. Why is it that patients now 2 years in are still hesitant to do things on day 1 or 2?
Everybody thinks it's a cold. They think it's just a cold. And so they don't treat it. I mean, this is actually a friend of ours. This is somebody who'd been at my talks. This is somebody who knew about early treatment. She'd heard me talk twice publicly in an arena. So she knew. I said, I'm not going to beat you up today because you don't feel good. But when you're better, I'm going to wring your neck for not calling me till day 12. Yeah.
What?
But it just goes to show that you can treat very sick patients as an outpatient if you know the disease process, you know the medications to intervene, and you've got something like hyperbaric oxygen. We gave her IV steroids, and again, we kept her out of the hospital. So it is possible. I'm now opening a location in Wildwood. We've kind of been waiting for some renovations to happen. So I think you've got some pictures there. Today was our first day we could move in. So we're anxiously trying to get this up. Again, it's nice to have a home base where we can send people in and just evaluate them in person. There's just nothing like being with somebody. You can tell a lot about how somebody's breathing over the camera, but you can see the blue there is our hyperbaric oxygen chamber. It's a soft chamber, so it's very different than others that you can find around the country.
Now you're only going to have one in this office?
No, that's just the first one.
Okay.
We'll probably end up with at least 3 or 4. There's 2 in Sheraton, and they're busy all the time. So, I'm not sure how many we'll end up with, but yeah.
How many patients have you seen? Do you know how many?
I can ballpark it. So as an ICU physician in the ICU, I estimate around 2,000 patients with COVID I took care of in the ICU.
Okay.
Probably half to 3/4 of those died, tragically.
I'm so sorry.
Yeah, it was a rough couple of years. Now my clinic altogether, we've treated around 4,000 patients. And when we got to them before day 7, we have 1 patient who died. And that was a patient who started early treatment by themselves, and I didn't know about it until the stats were in the 70s. Again, extremely high risk diabetic. We just couldn't get the everything turned around at that point.
What was the age range, if you don't mind me asking?
Yeah. So that was a
That does matter.
55-year-old.
Mid
That was
50s.
Yep, but 350 pounds plus,
Again,
extremely high risk. Got too far down the rabbit hole before we knew about him. I've had a handful of other people that have passed away. The most tragic is probably a 27-year-old.
oh,
They called me day 9. He had been turned away from the ER twice with 103 and 104 fever with no treatment. And I saw him at 9 o'clock at night, got him arranged for IV fluids, and the next morning, the IV center was calling me and said he died. I
oh,
looked at him on the camera and I talked to him. So around 2 a.m. So I had about 5 hours to be able to do something. So I don't consider that a treatment failure.
right.
Um, yeah, that was just heartbreaking. I can't even imagine.
And I, and, and in almost every episode that I've had with a doctor, they've told me a story like that, where they just crashed. One of their patients crashed and died the next day.
Yeah.
It's just so sad. It is so sad because COVID, and I shouldn't even just say COVID. Whatever you have, any respiratory infection or illness affects people in different ways.
Yeah, it does.
And
It does. We've had a handful of people go to the hospital. We have diabetics who have lost control of their sugars. We had one that went into DKA. We've had a couple dehydrated. Confusion is something that's really hard to manage at home. They need to go in and have a CT scan and a workup. There's a couple of strokes, which we know COVID increases clotting chances. I actually had one who had carbon monoxide toxicity and a stroke. So, yeah, yep. So, there's still patients, right? There are just things happen. We had a patient that we got oxygen to the home, and the next morning the wife called and said the SATs are still 79%. My question was, well, didn't the oxygen bring his stats up? Well, we couldn't get up to the bedroom, so he didn't wear it when he slept at night.
I know.
So, unfortunately, sometimes there's just a misunderstanding, clarifications. Unfortunately, that gentleman ended up having a stroke and passing away.
I'm
Um,
very sorry.
yeah, but so those are the kind of and those are patients that were in the 60s, 70s, 80s that are ended up going to the hospital.
But I will say this, Molly, someone like my mom, who is not in good health, she's disabled, she's on oxygen.
Mhm.
She was in a rehab place for just working, trying to get water retention out of her legs. She contracted COVID, and that's where I got it from. 4 days after she came home,
Mhm.
and I feel fortunate that she came home
Mhm.
because she got early and aggressive treatment and the monoclonal antibodies, which nobody can find anymore. She
Mhm.
got that on day 2.
Nice.
And I believe because she got that on day 2 and she was taking doxycycline,
Mhm.
I think that saved her life.
Oh, I'm sure.
That saved her life, and it gave me time to prepare. However, as I said, I was not. It was the most unusual thing because, like you said, I was preparing for the cold-like symptoms of the sore throat and headaches and everything else.
Mhm.
I didn't get any of that, and I credit that to the fact that I was taking supplements, vitamins, nasal spray. Nasal spray is a big one because the nasal pharynx is huge in reference to the viral load of COVID.
Absolutely.
I
Yep.
was doing that all for 18 months daily, and the nasal spray and the mouthwash 2-3 times a day.
Mhm.
And I've pretty much kept everything out in my regimen still. However, one interesting thing is, do we really know about zinc? I mean, you're not supposed to be taking super high levels of zinc because of copper toxicity.
Right.
So how do you drop that gradually? Like, I'm still taking the high amounts, and again, I'm doing that only for another few weeks because, again, you want to do that for the first for like a few weeks after getting rid of the illness. But
Mhm.
how do you now decrease the zinc level that someone like me has been taking for as long as I have?
So, I don't know, a lot of people have GI issues. zinc can upset the stomach. So I have a lot of people who actually can't do zinc. So what you could do is look up foods that are high in zinc and start to transition to those and off of the actual supplements.
And I think that's what I'm going to do. And it's interesting because I do have stomach issues, but zinc, and I know it's from the zinc. I have to make, like, right after I eat my first meal and take my vitamins, I have to sit and don't do anything for, say, 15 to 20 minutes because I noticed from the past experience that if I start being active, like after vitamins, that my stomach hurts for like a few hours. And I know that's from the zinc.
Well, good to know that. Yeah.
Very, very interesting. And again, I'm just saying that it's just an individual thing. But I want to get into this. This is what you offer for services for. Now, is this inpatient? This is virtual?
This is virtual. Yeah, these are our virtual services. So the prevention consult, basically, we actually are doing a group visit now. That's a little bit cheaper.
Okay.
We review your medical history. We review, we teach patients, again, when to start the medicines, what to watch for cytokine storm. It's not just a prescription. It is education, evaluation, what to watch for, how to be prepared, when to call. So this one is an acute consult. So this is, I'm sick now and need fairly urgent access. So with this consult, we offer our cell phone numbers, and we have patients, we offer 14 days that the patients can follow up with us. Because by day 14, they're either completely better or they slipped into cytokine storm, and we're able to address that and adjust their treatment.
Right. Exactly. And then this is where things get very difficult. Now, but I want to ask you, do you only offer this in Missouri and Iowa?
We do not. So we are available to help patients in all 50 states.
That is very important to know. And again, it's very important. Now, for example, say we'll go back to this one. I'm sick with COVID. Pay the money. When will you get the treatment? 24 hours? If say you're sending it from 1,000 miles away.
Yeah, so we work with compounding pharmacies, and it depends where patients are located, how quickly we can get it. So obviously, if you're there in the St. Louis metro, we can get it the same day. Our pharmacies generally were overnight medications. It's a little bit questionable when we have bad weather. We've got a big storm we're kind of bracing for right now. So we have had weather delays on some of that. That's why we really encourage people to do the prevention consult, so you have the meds already in your cabinet, and you can start treatment on your own at any time you have symptoms.
And all you need, and this is what I did. So what I did was I had everything on hand already. I had everything on hand. So all I needed was, and please don't do things on your own. Call a physician. Call a physician, especially an early and aggressive treatment physician, if that's where the route you want to go. And you talk to them. You talk to their nurse practitioner or their staff. And
so the box of ivermectin you just held up, so for people listening, that's the commercially available 3 milligram tablets. Okay, I'm a huge fan of those. However, they are quite expensive. So when you think of a 150-pound person, they're going to need 100 tablets. That's a $500 prescription when you buy it that way.
Right.
So we're almost exclusively going to compounding pharmacies. If we have a pharmacy that'll fill that temporarily for 1 or 2 days until the compounded gets there, but it basically saves our consult fee for the patient.
Right.
With us guiding them to a place they can get it cheaper.
And when I got it, and I got this in March of 2021, I paid $350. And by the way, to be fair, there's 3 of these boxes, not just one.
Yeah.
And because I wanted to have it on hand for myself and my parents, just in case. I did not want to just have it for myself and leave my parents without that option. And so I wanted to make sure they had it as well. And I have been very uncomfortable taking one thing that I'm very uncomfortable with is taking medication prophylactically that you don't necessarily need. And
Yep.
so,
For a short time, I was doing that with hydroxychloroquine and ivermectin. There's protocols for both of those. I generally am with you. I don't recommend that. You can't prophylax your way out of this.
no way.
And you're better off to do the nasal irrigation and the mouthwash to reduce the viral load than to take a pill constantly, because we don't know how that affects the gut.
And again, vitamin D levels, keep your vitamin D levels high and or on the high end of normal, say.
Mhm.
And again, there's so many other things you can do to just stay in good health. And I think that's the number one thing is promoting good health.
Yeah.
I mean, for me, I dropped 100 pounds during the pandemic.
That's amazing.
Which again, that's the key. That's the key is if I had COVID when I was 315 pounds, it could be a whole different story.
Yeah.
And when I was 215 pounds or 210 actually. Now, in my case, I'm a little bit different. I'm now working on, actually, I'm right now still gaining some weight. I need to gain because what happened was the last few pounds, the last, say, 10, 15 pounds were not in the healthiest form. So you also don't want to starve your body.
Mm-hmm.
And so what I'm doing now is I'm pretty much trying to get up to between 225, maybe go even up to 230, just to where you feel strong enough. And then I have right behind me a treadmill, and I'm also going to probably do some yoga as well. And
Nice.
just lose the last 30 I have to lose, and then just maintain the rest of my life. I feel like because there's also so much excess skin, and that's the other thing. You know, I'm not getting it done. Those are my battle marks. That's something to remind myself that never again to get up to almost 500 pounds.
Yeah, well, that's very commendable.
And again, I've been trying to use my small platform to promote good health, because I feel like good health leads to very good outcomes with not just COVID but any respiratory infection.
I would totally agree with that.
Mollie, I want to thank you so much for coming on. I wish you all the best with the with the James Clinic, the new Wildwood location.
Thank you.
And I also wish you all the best in treating patients early and very aggressively with the illness that's still around. I guess I'll ask you one final question. How is it right now in your area?
Mm-hmm. So the numbers, we just had a little peak again a week or so ago. The numbers seem to be coming down a little bit. I have a bias sample because I get calls from the sickest patients who are in the hospital and trying to get out. So I'm still seeing those very sick patients. I'm hoping this is dropping off soon, though. I think we're all ready to be done with it.
Well, more and more of my family and friends that I talk to tell me that they're through with COVID.
Mm-hmm.
I mean, what I don't understand is how the medical establishment wants COVID to never come to an end. It has to be a money thing. There's no doubt in my mind this has to be a money thing.
And it's a liability thing too. They're exempt from liability, and there are all kinds of adjustments that are made in normal hospital operations through this.
Well, very soon, I don't think they're going to be liable. They're going to be held liable very soon. Very soon, I think they're going to be held liable, because there's going to be so much pressure put on. And I think the last thing they fear is a huge red wave come November, because sadly, this has all become political.
Yeah, which is really sad, because it's not. This is a human issue. I don't ever ask my patients who they voted for. I don't ask their political beliefs. I just take care of them. And so how this became political, I think it just comes down to fundamental beliefs. Do you believe the government is out for your best interest and needs to take care of you? Or are you an independent person who wants to take care of yourself?
And I'm going to go further.
Mm-hmm.
Do you even care? I'm sure you don't.
Mm-hmm.
And none of these treatment doctors care if a person's vaccinated or not.
No. No, we want people to know, regardless of what you chose or your motivations for doing that, early treatment is an option for you. I think that's one of the most important messages we should be echoing.
Yes, exactly. And it should be a major thing, especially now that we know that you can catch COVID more than once.
Mm-hmm.
There are plenty of people that have caught it multiple times.
Myself.
Fortunately,
mm-hmm.
the chances of dying from getting it a second time are minuscule.
Right.
So, Dr. James, thank you so much for coming on tonight. I hope I can get you back on very soon because I want to talk a lot about gut health in general. And because that's a major, major topic that not just affects COVID and we saw long COVID, but it's amazing how it affects other illnesses that nobody's talking about, like Alzheimer's and dementia.
Correct. Huge.
That's a topic we could just talk about for 2 hours straight.
Yes.
But once again, thank you so much for coming on.
Thank you for having me.
Have a great night. And once again, thank you for watching episode 15. Tomorrow night, my guest is going to be Jeffrey and Renee Myers. We're going to talk about something that long after the pandemic is going to be a horror show. And it's a horror show now, but it's going to be worse, which is mental health and COVID. It is just so sad what we have done to our children. And so tomorrow night, 7 p.m. at this time, please tune in for episode 16. And once again, thank you for watching tonight. Hope you have a great night, and bye-bye.